All right, let's talk about something fascinating. There's this hidden force, an invisible ingredient that plays a huge role in every single medical treatment we've ever had. And today, guided by the incredible work of Dr. Ricardo Ferreira, we're going to uncover what it is, what makes or breaks our healing, especially when we're talking about something as complex as cannabis therapy. So let me just start with a question that's kind of a puzzle. Have you ever wondered how the exact same medicine, the same dose, can be a lifesaver for one person and do absolutely nothing or even make things worse for someone else? Well, it turns out the answer isn't just in the pill or the plant. And Dr. Ferreira puts it perfectly. There's this invisible ingredient at play. It's this force working behind the scenes, and it's powered by something we all have, our own expectations and beliefs. But to really get it, we've got to take a step back and see how modern medicine kind of forgot all about it. To get why we think the way we do now, we have to go back to this huge fork in the road in the history of medicine. Think of it like a philosophical divorce, and honestly, it still impacts your doctor's visit today. And wow, look at this. The difference is night and day, right? On one side, you've got these ancient traditions where the mind and body are totally connected. Healing is this whole big ritual, a part of life. And then along comes Descartes, who basically says, nope, the body is just a machine, a fancy clockwork. And the mind, that's totally separate. Suddenly, medicine became all about fixing broken parts. Now, don't get me wrong, this body as a machine idea led to amazing breakthroughs. We got incredible drugs, life-saving surgeries, but there was a huge cost. We completely disconnected our physical symptoms from everything happening inside our heads, our feelings, our fears, our hopes. But here's where it gets really cool. Modern neuroscience is now proving that those ancient folks, they were totally onto something. That invisible ingredient we've been talking about, it's not magic. It's a real biological pharmacy that you carry around inside your own brain. We've all heard of the good side of this, right? The placebo effect. It's that amazing thing where you feel better, not necessarily from the drug itself, but from everything around the drug. The trust you have in your doctor, the simple act of taking a pill, just believing you're on the right track. But there's a dark side, a kind of evil twin called the nocebo effect. This is when your negative expectations, you're worried about side effects, you doubt the treatment, actually create real harmful symptoms, even if what you're taking is just a sugar pill. And I want to be crystal clear about this. This is not just all in your head. These are actual, tangible, biological events happening inside your brain, and they can completely change how you respond to literally any treatment. So let's peek inside that secret pharmacy in your brain, shall we? The second you start believing a treatment is going to work, your brain gets busy, it starts pumping out its own powerful drugs. We're talking natural painkillers, a rush of dopamine for motivation and reward, even its own version of cannabinoids. It's incredible. Your hope literally becomes biology. So what about the flip side? What happens when doubt takes over? This is what Dr. Ferreira calls the doubt that sickens. And yeah, it kicks off a totally different chain reaction in your body. Instead of all those feel-good chemicals, your brain sounds the alarm. It revs up your main stress system, that's the HPA axis, and it activates another system that ramps up anxiety and pain sensitivity. It's kind of chilling when you think about it. Your fear is literally making you feel worse. And the research shows some of us are more susceptible to this. For reasons we're still figuring out, it looks like the risk of experiencing a nocebo effect is about 2 times higher in women. And check this out, this is just staggering. Your mindset is a massive factor. If you're already dealing with something like anxiety, or you just tend to have a more pessimistic outlook, your risk of having these negative nocebo effects can skyrocket by 5 times. 5. That's huge. Okay, so what does all this have to do with cannabis? Well, this is where things get really complicated and really interesting. I mean, think about it. Cannabis isn't like Tylenol. It's not a blank slate. It's loaded with all this cultural baggage. For some people, it's a miracle cure-all. For others, it's still a scary, dangerous drug. All of that hope, hype, and fear acts like a giant amplifier for both placebo and nocebo. It makes a patient's mindset more critical than ever before. So, knowing all this, what can we actually do about it? How can we manage this invisible ingredient? Let's get into some practical strategies for both patients and clinicians to kind of hack the healing process. This is so powerful. The words we use literally create our reality. Just look at the difference here.
Instead of a negative warning like, this might cause sleepiness, you reframe it to a positive. This can have the added benefit of improving sleep quality. Instead of a cold clinical question like, rate your pain, you ask a human one. How would your life be different without this pain? You're actively shifting the brain's focus from a threat to a hope.
So, for any doctor or clinician, the real goal is to build a new kind of toolkit. It's not just about the prescription, it's about managing expectations, you build trust, you empower people with knowledge, you frame everything positively, and you use the simple, incredible power of testimony. Just sharing success stories can build a real foundation of hope. And this brings us right back to where we started. By using these tools, we can change the modern doctor's visit from just a sterile, mechanical transaction back into what it once was, a powerful healing ritual. This is where the appointment itself becomes part of the treatment. When a doctor creates that safe space, listens with real empathy, and works with the patient to build a new story of what's possible, they are literally unlocking that patient's own inner pharmacy. It's the ultimate shift in perspective, isn't it? The doctor's job isn't just to be a technician who fixes a machine. It's to be a guide, a co-author of a new story for the patient, a story where change is possible and hope is the primary ingredient. So after all this, the history, the neuroscience, the practical advice, what's the single most important thing to take away from all this? What's the one idea that really changes everything? And here it is, the whole thing in a nutshell. That connection between a doctor and a patient, the trust, the communication, that's not just a nice little add-on to the real medicine. In a very real, very biological sense, it is the medicine. That invisible ingredient we've been looking for this whole time, it's always been the relationship itself.